So in this presentation, because it seems that difficulty with the McDonald criteria could lead to misdiagnosis, we really emphasized a lot of tips and advice on how to properly use the criteria. So there's a lot of perhaps misconceptions about the diagnostic criteria. And really the most important thing is to first read the document, read the manuscript. A lot of times the diagnostic criteria for MS are reproduced on little cards that don't have all the caveats for different diagnostic situations, and it's really important to know all the details first. We emphasize in this session that the first step in making a diagnosis of MS is identifying if a syndrome in the patient that you're seeing is what we might call typical for MS, or an MS typical syndrome, and that there's evidence, objective evidence, we call it, of CNS involvement. So corroborating evidence on their neurologic exam or MRI that there's a lesion responsible for the syndrome. That's the first step in making a diagnosis of MS. If the syndrome is atypical or there's some red flag, something that's unusual, you can't really even apply the McDonald criteria because it hasn't been validated in patients like that and would lose its specificity. So being very familiar with what those syndromes are, which are essentially optic neuritis, myelitis, and some brainstem syndromes, that's it. And knowing how to verify that there's objective evidence of those syndromes is really key skill in making a correct diagnosis.